This segment is brought to you by Busamed Paarderbly Private Hospital.
Dr. Fourie, thank you for joining us on Living Your Best Life.
It's a pleasure.
So you are an oncologist here at Busamed in Paarderbly. Let's talk a little bit about your practice.
Okay, I've started 3 years ago in my practice. I started in Paarl, and then basically 2 years ago I started my practice here at Busamed. Last year we actually opened up chemo facilities, which is a big win for the hospital. And then from there on, it's basically we see a lot of cancer patients referred from GPs, a lot of patients from other doctors actually that also involve us in the decision making, and patients coming for second opinions also to ask that they've heard about the team involvement that we've got, so they actually come and they want the team to be involved with the treatment, which is also a very nice thing from the patient side. Yes.
So you deal with all kinds of cancers?
Yes, because I'm a radiation and clinical oncologist, I treat any type of cancers, from gastrointestinal, breast, hematology, but we have a special focus also on the breast cancer patients, and because our multidisciplinary team focus, there's a lot of interest on breast cancer patients. So.
Let's talk a little bit about your multidisciplinary team. What does that comprise of?
Okay, so we have me as the oncologist, and then automatically there's 2 surgeons, Dr. Leana Rood and Dr. Heinrich Pohl, that's got a special interest in breast cancer. And then we also have the gynecologist, Dr. Ramon Aronius, that's part of the team, the plastic surgeon, Dr. Rory Douwer. And then part of our team is also, we have the pathologists, the radiologists that sit in, as we discuss each patient, a psychologist, a geneticist, and then also we have a social worker and a palliative sister. So we see the patient as not just a disease, but as we treat it holistically. So we try and address basically the right decision making on the type of cancer the patient has, but also taking into consideration the emotional aspects, and also getting the social worker involved or the psychologist involved, and treating that part also to make the journey easier. Yeah.
So, you know, having to find out that you have breast cancer can be very traumatizing for anybody. So having this multidisciplinary team, how does this benefit the patient?
I think the patient feels safe that a lot of doctors have discussed their case. It's not just one person looking at the result and then making a decision. So we literally look at the images together. We discuss the different pathologies, the histology, and then we will use our knowledge from all the guidelines that we in any case use to treat the patient, but with that we actually make the best decision. So sometimes it's a to and fro between a lot of our specialists, but the outcome for the patient is much better, that we can tell them the team decided that this is the best treatment. And I think the patients like that because they feel safe, yeah, for them. Yeah.
So what I'm hearing is that besides just the physical aspect of the patient, there's also the emotional aspect that the team does take care of.
Yes, because a lot of the time it's not just being diagnosed with the cancer, and we forget many times the family, the husband involved. So we do, even the social worker's got actually a project that he wants to have meetings once a month with the husbands, so that they can discuss how they feel with the wives being diagnosed with breast cancer, and to support them, because many times we forget that there's a lot of issues at home also involved. Yeah. So I think that's nice for the patient, and it's like a family. They feel almost part of a family, to make the journey easier. Yeah.
What bit of advice can you give our viewers today? Somebody that is suffering with cancer or breast cancer, how do you suppose that they could make their lives a little bit easier?
I think many times the diagnosis is very traumatizing, and I think at that stage you forget, it almost feels like your life is ending. So I think if you sit with your team involved with your breast cancer and you have an open relationship with the doctors involved, your surgeon, your plastic surgeon, whoever is part of your team, the oncologist, and you see them as part of your team, you involve them in whatever you experience to make your journey easier, you can get through it. And you take it day by day. You literally don't have to look at the outcome in the beginning when you hear the diagnosis. You walk this journey with your team, and it makes it easier. Just doing it step by step, breaking up this big thing into small steps so that you can get through the treatment.
Yeah, I think a lot of cancer patients, block off that help, and they internalize the stress and the traumatic, news. One of the most important things that you've spoken about in the multidisciplinary is being able to speak to a psychologist.
Yes. And we have a great lady very involved with us, and she will give us feedback if she see the patient and she's worried. She will definitely give us feedback if we need to get a psychiatrist involved as part of the team. So many times it's just talking to someone, just briefing on how you feel. That's not part of your personal space. That helps you get through this journey. Yeah.
Perfect. Well, thank you so much for joining us on Living Your Best Life.
Thank you.
Busamed Paardersvlei Private Hospital offers more than exceptional clinical care by bringing our company values of accountability, friendliness, respect, integrity, and quality care to life. Busamed Paardersvlei Private Hospital offers their patients and their visitors the ultimate Busamed experience. Premium care, personal touch,